Spirit Radio Podcasts.
Gambling was in the news last week with new figures released by the HSE showing that gambling addiction is on the rise, with at least 257 cases dealt with by HSE addiction units last year, where gambling was the patient's number one problem, a significant increase on the previous year. So why is gambling addiction on the rise, and how can people affected directly or indirectly by gambling addiction get help? On the line to tell us more we have cognitive behavioural therapist and addiction consultant Dr. Susan Byrne from the Connolly Counselling Centre. First of all, Susan, is that your impression too, that gambling addiction is on the rise?
Yes, absolutely. I would see it in my clinic. There's been quite a severe rise over the last number of years. And I would say, Rónán, not just in gambling addiction, but across all the addictions in the chemical and behavioural ones. And, you know, what I'd like to explain, first of all, is that addiction doesn't happen overnight. Somebody doesn't wake up one morning and become an addict, and it doesn't happen over a week or over a month. Addiction is a very slow, gradual process that happens over an extended period of time. And when we look at some of the causes of gambling addiction in particular, we need to look at things like family history of addiction. So if you've grown up, or if you have a member of the family that has an addiction problem, in particular to gambling, you're probably more predisposed to developing that problem yourself. Early exposure is another one. Peer pressure. And what I would see a lot of outside of those particular areas would be self-medicating. So you'll have somebody who develops a gambling problem because of maybe relationship issues,
Sure.
low self-esteem, depression, stress, and they're masking it. And what is even more troubling when we look at the figures that were released last week is that where we find an addiction like gambling, Rónán, we're very, very likely to find a second addiction. And that second addiction usually presents itself in a chemical addiction, which is alcohol or drugs. If you have somebody who has a gambling addiction problem, they have very high levels of anxiety and depression. To cope with the high levels of anxiety and depression, they will turn to something like alcohol or drugs.
To medicate that. And it's interesting. Can you just explain to us, you know, because I can see, for instance, there's a clear sign, for instance, where you have like the classic thing, you know, you're a GAA player or you're a rugby player, and you're getting blood tested, so you can't take substance, so therefore you go to gambling. But are there ways in which gambling, say for instance, gambling as an addiction and say a substance addiction is different?
Yes, yeah. Well, they are different, but they're actually doing the same thing. So if you're gambling, what you're doing is you're looking for the buzz, you're looking for the chase, you're looking for the high. Yeah. You're doing the same thing if you're drinking or if you're using cocaine or if you've got an addiction to sex or pornography.
Yeah, exactly. That's what you're saying.
Yeah. And when we look at a gambling addiction, what you're looking at are two things. It's impulsive and it's compulsive. So the impulsivity in gambling addiction gets stronger and stronger over time, and it's compulsive thinking. So we would say in the field of addiction, you meet the criteria of being an addict, even though I don't like that phrase, but you have an addiction issue, if you're actively involved in it, or if you're recovering from it, or if you're thinking about when you can next do it, when you can next get that chase or get that high. And,
you know, you mentioned earlier on, you know, that you this might begin as a kind of a self-medicating. I'm using it to deal with a feeling of, you know, low mood or depression, or I may have high anxiety or chronic anxiety, and I'm medicating that. So does it tip out? Does it go from kind of this self-medicating and then suddenly kind of tip into something more compulsive?
Yes, it can do. And what we would see is what we would refer to as a dual diagnosis. So often somebody presenting with a gambling addiction problem could also have a co-occurring mental illness. So you could be looking at somebody who has bipolar or a mood disorder that was never assessed.
Undiagnosed or whatever,
Absolutely, or somebody with a personality disorder. I would see a lot of clients who would have ADHD and would be addicted to gambling. And then you've got anxiety and depression on top of that.
And so it was missed. The ADHD was missed on the way up, and suddenly they're presenting with, I'm an addict, and you're going, hold on a second, there's something going on in the background there. It's tricky enough, isn't it?
It's a minefield.
Yeah. So can you give us an idea? I'm thinking now, people listening in, and they're going, I wonder if my loved one or my son or my daughter or whatever is involved. Are there any signs and symptoms that we could watch out for in gambling addiction?
Absolutely. Look for things like reduced social activities, okay? So there's a reduction in engaging with family and friends, looking for isolation, people wanting to be on their own, not fulfilling work obligations, so missing work, missing meetings, missing commitments. Excessive spending would be a big one. We're looking at things like in the home, maybe hiding bank statements, excessive time on a smartphone. Now, when we think about this, Rónán, think of, say, an 18-year-old kid at the back of a bus going from one, stop to the next. He could have spent €500 in the space of 10 minutes.
This is the awful thing. It's not bookies anymore. It's all on the phone. So deadly, isn't it? So deadly.
Yeah.
So how do you treat it, Susan?
Okay, well, treatment, the way I work is through CBT. So I would say that there are always 3 strands to somebody with a gambling addiction. There's therapy. There's lifestyle changes, which is really important, and then there's medication if appropriate. So the therapy would come in the form of cognitive behavioural therapy, what we refer to as CBT. And the way CBT works is it's very simply how we think, Rónán, affects how we feel, which in turn affects our behaviour and what we do. So we challenge the negative and the pessimistic thinking and thoughts patterns and replace them with more positive thoughts and behaviours. Coupled with that, then we look at lifestyle changes. So it's getting family support. It might be going to GA for meetings, nutrition, exercise. And then, if necessary, we may look at medication. Now, I'm not an advocate of medication, but I do think that there's a place in terms of when anxiety and depression is so high, sometimes you need a medication to stabilise.
I know take
the edge off.
Yeah, sometimes they're actually unable to engage with the therapy almost, and you just I know.
That's it.
So just from a purely personal point of view, Susan, do you get annoyed when you see football matches on TV bookended by gambling ads?
Completely. You'd hear me screaming at the TV, screaming at the television. It's completely unnecessary, and all it's doing is advertising and making something. It's normalising something which isn't normal. Yeah. It isn't normal practice. It's highly dangerous. I mean, looking at the clients coming into me, and they're getting younger and younger. I mean, gambling addiction, as most people probably know, is more prevalent along in males. But I'm seeing an increasing number in women in their 40s and 50s presenting with the gambling addiction.
Gosh. Yeah. Wow, that's amazing. Yeah. So, look, if someone's listening in this morning and thinking, I know I've got a problem, what should they do?
Okay, talk to somebody. I would always suggest that maybe your GP is the first port of call. Then you've got the HSE website, www.hse.ie. Some very good information on that website, and some other links to literature and reading. And then you've got Gamblers Anonymous. Now, Gamblers Anonymous isn't for everyone in terms of meetings, but again, it's a really good website with lots of information. And then you have the Addiction Counsellors of Ireland website. Outside of that, Rónán, you've got great places like St Patrick's Hospital, John O'God's, and the Rutland. And then there's private clinicians that you can go and talk to somebody. And I would also say, Rónán, and this is really important, if somebody thinks that they have a problem with gambling, they may not be ready to address it just yet. The fact that they're aware of it, that they think there's a problem, that it's damaging family, it's damaging relationships with friends, with work, with finances. The fact that people are thinking about it at the moment, that's okay. That's fine. That's the first step. What I'm saying is they may not be ready to actually engage in therapy.
Yeah. Absolutely, but these are the kind of the shallow waters, but they can get some more later on. So are the prospects for recovery good, Susan?
Yes, with I mean, would you say there's a cure for any of the addictions? You manage addictions. Yeah. There's certainly excellent treatment plans, and yes, they can be managed very well. Yeah, absolutely.
Lovely talking to you this morning. Dr. Susan Byrne from the Connolly Counselling Centre. Thank you so much for joining us.
Thank you, Rónán.
God bless you. Bye-bye.
Thanks for listening to our Spirit Radio podcast. Don't miss out. Subscribe today. Find out how at spiritradio.ie.